Hello, everyone. You're welcome to my YouTube channel. I'll be discussing candidiasis and indwelling medical implants. First of all, we'll look at what candidiasis is. Candidiasis is an opportunistic fungal infection that is usually or frequently associated with patients with altered immune status. Candidiasis is caused by Candida albicans, which is the predominant etiological agent. There are principal risk factors predisposing to deeply invasive candidiasis. These include the following: general debility, the use of corticosteroids, cytotoxic chemotherapy, long-term courses of broad-spectrum antibiotics, and the use of indwelling medical implants. What are the clinical manifestations of candidiasis? We have the following: oral candidiasis or thrush. Here, white patches are formed on the side of the mouth, on top of the tongue, and surrounding the lips. Cutaneous candidiasis occurs in areas of the skin where there is very less ventilation and uncommonly wet. Moist red patches are formed on the skin. These anatomic sites include the area of wearing diaper, hands on which rubber gloves are regularly worn, base skin of the fingernail, area surrounding the groin, and cleavage of huge breasts. Vaginal candidiasis or Candida vaginitis. Women have a very high chance of developing vaginal candidiasis at least once during their lifetime. Pregnant women and diabetic patients are more vulnerable to vaginal candidiasis, and patients who abuse antibiotics are also at risk of contracting candidal vaginitis. The antibiotics that are abused by these patients clear the friendly bacteria and allow overgrowth of Candida albicans. The symptoms include itching and pain in the vagina, a thick discharge of cheese-like appearance, scorching sensation surrounding the vagina, and irritation. The other forms of candidiasis include pulmonary candidiasis, candidemia, that is the presence of Candida in the blood, candiduria, the presence of Candida albicans in urine, balanitis, which is prevalent among uncircumcised males. Candidiasis and medical implants. Medical implants which can be colonized by Candida albicans include dentures, dialysis vascular grafts, urinary catheters, cardiac pacemakers, prosthetic heart valves, orthopaedic valves, intrauterine devices, among others. The commonest superficial Candida infection of the oral mucosa is denture stomatitis. Here, a mixed species biofilm, which contains bacteria, mainly streptococci, and yeast, can be found on the surface of a close-fitting acrylic denture. For a prosthetic heart valve, there will be platelet and fibrin accumulation at the suture site, as well as tissue damage may occur following the implantation of prosthetic heart valve. Candidemia occurs as a clinical finding in such cases. Another indwelling medical implant, which can be colonized by Candida albicans, is the dialysis vascular grafts. Patients with end-stage renal disease requiring hemodialysis can be infected when dialysis vascular grafts are implanted. Also, pelvic inflammatory disease can occur after the implantation of intrauterine devices. IUDs. These IUDs, when removed from women who have been shown to have problems, are severely contaminated with Candida albicans. Hip and knee orthopaedic devices are the commonly infected implanted joint prosthetics. Early debridement will save the devices from being removed. Immunocompromised patients with indwelling catheters may also present with hematogenous candidemia. Candiduria may occur in patients with open catheter systems. Laboratory diagnosis of candidiasis. Specimens consist of swabs, scrapings from surface lesions, exudates, materials from intravenous catheters that have been removed. The specimens can be examined in stained smear for pseudohyphae and budding cells. Skin scrapings are first of all placed in 10% potassium hydroxide. All specimens are cultured on Sabarot dextrose agar at room temperature at 37 degrees Celsius for 48 hours. Typical colonies are then examined for cells and budding pseudomycelia. Chlamydospore production by Candida albicans on cornmeal agar is an important differential test. Medical management of candidiasis. Thrush and other cutaneous forms of candidiasis are usually treated with topical nystatin or oral ketoconazole. Systemic candidiasis is treated with amphotericin B, sometimes in combined therapy with flucytosine, fluconazole, or capsufugin. Medical implants which have malfunction have to be removed and patients treated with antifungal agents. The new drug approved by FDA, Food and Drug Administration, in 2023 for the treatment of invasive candidiasis is rezafugin. The surface of a medical implant should be coated with anti-infective agents. Here are selected references for further reading. Thank you for listening.